Cerna, and we're from Short Physician Group, okay? But we're here, and thank you for being this early. It might be early for you guys, right? So thank you, okay, for being here. And we're happy to be here so we can share. I think knowledge, as I always say, is what? It's power, okay? So the more that we know, the better it is, okay? And why not talk about diabetes, right? So diabetes, I like to be very interactive, okay? So let me see. I'm just going to be asking, okay? Does any of us that were here, are we diabetic? You want to raise your hand? Okay. Keep your hands up. Keep your hands up. Do any of us have a family member that's diabetic? Raise your hands, okay? Does any of us, keep the hands up, okay, have a friend or a neighbor that's diabetic? Do we know somebody that's diabetic? Keep your hands up. Yes, right? So if you see, diabetes is something common, right? Or we're diabetic. Yes? Oh, you can put your hands down. Hands down now, okay? So diabetes, or we're diabetic, or we have a family member, or we know somebody that's diabetic. So that's why it's important that we learn more about it. And we're going to do it very simple, okay? We'll try to do it the most simple way, because that's the way that we're going to learn and make better decisions, okay? So the first thing is, I think this is the Spanish one. Yes, can I turn the English one? Wrong group, right? We'll do the English one.
Well, that's Hilson's fault, because he switched it on us at the last time.
I'll just put the English one. And like it's diabetes, same in Spanish, so I'm like, oh, diabetes. Yes, that's the one. The first one. That one. There you go. There you go. So now we're in the right spot, right? So what is diabetes? That's the question, okay? And I'll do it very simple, okay? We need to know two terms over here, okay? One, it's glucose. And the glucose is the blood sugar. So where does the blood sugar come from? It comes from our food. We're eating, okay? It gets digested, okay? And we break that down, our food, to blood sugar, okay? So we have the blood sugar, and then another term that we need to know is a hormone called insulin, okay? So what is diabetes? Diabetes is when we have a lot of blood glucose, which is the blood sugar, a lot of glucose in our blood, okay? The glucose, which is the blood sugar, okay, it's important because we need that as an energy resource, okay? It's our fuel. Our cells, our body, everything cells, okay? Our cells need the blood sugar, okay? So the blood sugar needs to be inside, okay? Inside the cell, not outside. So I'll show you something. We're going to do something very simple over here, okay? So the blood sugar needs to be inside the cell. But with diabetes, the blood sugar is not inside the cell. It's in the bloodstream, okay? What is the one that, I don't hear myself, we're good? Yes? Okay. The one that helps us bring that blood sugar inside is the insulin, okay? So we'll do something very simple over here, and I just want some people to help us. Brian, you're going to come over here, please.
Yeah.
Okay, I want to make a circle. Circle for me. You want to come over here? Do you think you can come and help us over here? Yes, Tiffany, come over here. Okay, you guys are going to be a cell, okay? You're going to just grab your hands. You're going to get together, okay?
All right.
A circle. Close the circle.
Close the circle.
Yeah, there you go. There you go.
Now what?
So, they are the cell, okay? And now, I'm going to use, you're going to come. What is your name? Abraham, okay. So Abraham is our blood sugar, okay? The glucose, okay? And now I'm going to be the insulin, okay? So the blood sugar needs to be inside the cell because that's where we get our energy from, okay? So I'm the insulin. When there's a lot of blood sugar there, the pancreas produces the insulin, and I'm the one, okay, we have a blood sugar here. Open, go inside Abraham, okay? And that's what is normal, okay? You got what I'm, yes, that's normal, okay? But what happens, so you guys got the concept, right? Very simple. We got a cell. We got the blood sugar. The insulin is the one that brings the blood sugar inside the cell. We need the glucose, but it needs to be inside the cell, right? What happens? Thank you so much. Wait, stay there, okay? Okay. So what happens with diabetes? We have a lot of the sugar, the blood glucose, okay, outside of the cell. It could be because me, the insulin, I'm not producing, they're not producing me anymore, or it could be because I'm just not effective. So guess what? The blood sugar, yeah, they're blocking. Okay, you want to go in, but with the diabetes, that glucose cannot go in because I'm not working correctly or I'm not being produced. We got an idea? Did you like that example?
Yeah.
Thank you so much. Go back. Thank you so much. You guys are good actors. So that's what's happening with the diabetes, okay? I like this. Just one more time, okay? The blood sugar comes from your food, okay? Pancreas produces the insulin. Insulin is like the key, okay? These are your cells. We need the blood sugar inside the cells so we get energy, okay? But what happens? With the diabetes, that insulin, it cannot bring the blood sugar inside the cell. So that's why when you check your blood sugar, your numbers are high, okay? Because it's in the bloodstream, it's not in your cells, okay? Let's put it like that. This one I had like change it. So, knowing what diabetes is, now I'm going to tell you what are the types of diabetes, okay? There's more into it. I'm just going to concentrate on these, okay? There's the type 1 diabetes. What's happening in the type 1 diabetes, okay? The pancreas, it's not producing the insulin, okay? Initially it can produce a little bit, but then by time, it's going to stop producing it, okay? And what's happening? So your blood sugar is outside, right? You have a high blood glucose. And the type 2 diabetes, it could be because of 2 reasons. One, okay, there's resistance to the insulin, meaning that you have the insulin, but it's not doing its work correctly, okay? Or you're not producing too much, okay? So those are the 2 types, these are the ones the most common, right? I think some of you have heard about gestational diabetes, right? When you're pregnant, hormones, and that increases the risk of having diabetes, okay? So, same thing. I'm just using a lot of figures, okay? Type 1 diabetes, usually in young patients, young people, okay? Usually it's autoimmune, okay, related, like your immune system is attacking your pancreas. And remember what we saw before, pancreas cannot produce insulin, so your blood sugar is going up, okay? And so without insulin, your body cannot manage your blood glucose, okay? Type 2, patients with type 2 do not produce enough insulin from the pancreas to manage the blood level, or there's resistance to the insulin. Not the good quality. Let's put it like that, okay? So once we know what is diabetes, we know the types and what's the difference, now I'm going to tell you what are the most common symptoms of diabetes, okay? I don't know if any of you that were diabetic remember, oh, these were the symptoms that I was having. The most common ones, you feel thirsty, okay? Not a good sign. You're thirsty. You want to drink water, okay? Because you're trying to compensate it. What do you guys do? Something simple. When you have a juice and it's so sweet, what do you guys do? Well, at least I do. I add more water to it, okay? So same, you're like trying, that's just something to compare. You know, there's a lot of blood sugar. Your body is trying to compensate. You're drinking a lot of water. That's one thing. Another thing is you're peeing a lot. You're peeing. That's one of the other common ones. And another one, you're feeling hungry. You're hungry all the time there, okay? I see some smiles there, right? Then what happens, you can, and the another thing is that you're losing weight, okay? Patients think, oh, I'm healthy because I'm losing the weight, but that's an unhealthy weight loss, okay? And once your diabetes is better controlled, you start gaining the weight, okay? And sometimes people get like, oh, what's happening now? I'm not doing well. No, that's a good weight gain, okay? Your diabetes has been managed better, okay? And then, of course, You can have blurry vision. Oh, I can't see. I have a lot of patients, right? I was seeing well, now I can't see. Blood sugar is 300s, okay? Your cornea it's swelled up, so you're not seeing. You're having a blurry vision there, okay? Of course, nausea, so other things, but those are the three big ones, okay? So, I'm just going to go back to this one, and that's the one that I had switched. So, how do we diagnose diabetes? I like this one, and I always show this to my patients, you know? So, I like this one because we have tests, okay? That's why it's important that we all go and see our primary care doctor, okay? So, an A1C instead of ABC, okay, it's an A1C, okay? It tells me how your blood sugars have been during the last 3 months, okay? So, if we got an A1C of more of 6.5, diabetes, okay? Of course, if you don't have symptoms, it's always good to repeat it, okay? Or if you have a fasting blood sugar more than 125, or there's other tests, right? Called the glucose tolerance test, more than 200, or you do a random blood sugar and you come here on fasting, you know, and randomly I have a blood sugar of 300, oh, you're starting to think, oh, you might be diabetic, okay? And you have the symptoms. Are you feeling thirsty? Yes, doctor, I'm feeling thirsty. Are you peeing a lot? Yes, I'm peeing a lot. Diabetes. I just saw right now a patient like that. I'm like, you're diabetic. And we checked the blood sugar, and his blood sugar was 291, okay? So, that's how we diagnose it, okay? So, let's keep over here. So, we have to know that if you have a condition, there are risk factors. We have risk factors that we can change, and we have risk factors that we don't have control of that, okay? So what are the risk factors that we can change? Okay, you're going to tell me, what do you guys see over here? What's happening there? Describe the picture.
Sit there, lay down, get up.
Exactly, very good. Yes.
Stop eating wrong things. See chips.
Yes. Just sitting there watching TV. I always tell my patients, you're watching TV, there's a commercial, get up and walk and do something. Don't sit there, okay? Just, you know, now with work, everybody's working in front of a computer. I feel I'm one of that, okay? Oh my goodness, I'm like, I've been here sitting so long. That's not good, okay? So a sedentary lifestyle, that's a big risk factor. Can we change that? Yes, okay? It's not that you have to run a marathon, but you know, if you start doing things and start moving, that's just going to be better, okay? What do we see over here? Is this healthy or unhealthy food?
Unhealthy.
Thanks, Brian, that he brought the free sugar things, right?
Cupcakes are sugar-free.
Yeah. So that's another thing. Do we have control of that? Can we eat it better? Yes. Okay. So what is this? Obesity, overweight. We can have, and they're all related. If the more sedentary that we are, not all the time, okay? The unhealthy food, you know, that's going to lead us to overweight, right? Okay, and these are risk factors for type 2 diabetes. And of course, you know, if we have other chronic conditions, let's say like hypertension, you know, a high cholesterol, you know, smoking, that also increases the risk for diabetes, okay? Can we change these? Yes. If you're already diabetic, you have a power. And what is the power? Doing this, you know, being more physically active. They're going to talk to you about that, okay? Now, there's other risk factors that I don't have control of that, okay? We all age, okay? I don't want to keep on aging, but that's how it is, okay? We don't have, and as we age, we have increased risk factors for diabetes, okay? Another thing, race, ethnicity, you know, it's more common to be diabetic in Hispanics, okay? Asians, African Americans, okay? There's an increased risk, you know? And then family history. Dad, mom, you know, what else? My grandparents diabetic. My family is diabetic. That's why I try to be very strict with myself, because if I don't take care of myself, I have an increased risk factor there, okay? So I cannot change that. I cannot change my genes, but I can change this, okay? And that's where we have to work on, okay? So I like this because it tells me things that we can change and things that we cannot change. All of these are risk factors for type 2 diabetes, okay? So, we talked about that. I just put this here because I want the persons that are diabetic, okay? It's not strict like that, but just to have an idea that we should meet goals, okay? I always ask my patients, or the new ones, okay, You're diabetic. Do you know what an A1C is? Yes. Or some tell me no, and you've been diabetic for 10 years and you don't know what an A1C is, okay? Your goal, what is our goal? It depends, okay? It depends on the age, and it also depends on like other, if you have other disease, you know, other chronic conditions. But we'll say like from 7 to 8. It depends, okay? That's it good. Because this gives me an average of how your blood sugars have been, okay? Your fasting blood sugars, they can go up to 130, okay? That's good. Don't, if you see a 120s, 130s, that's good, okay? That's around what we want. And 2 hours after we eat, it should be less than 180. If we're hitting those numbers, it means we're doing good. If you're like, I have to improve, so we can improve. How can you improve? See your doctor, right? Take your medication, and you work on the risk factors that we can change, okay? So, what happens if I don't take control of my diabetes? You're going to have complications, okay? And I'm almost done with this, okay? So, I always ask 3 things, okay? No, 4 things, okay? Eyes, kidneys, and your nerves, your feet, okay? So if diabetes, remember, the glucose, the blood sugar needs to be inside the cell. But if the blood sugar is outside the cell and it's in your bloodstream, it's toxic, okay? It's toxic to the nerves. It's toxic to your eyes. So that's how you get complications. By years, if you don't have it controlled, you're going to have complications, okay? So what eyes? Retinopathy, okay? You're not... that's why a diabetic patient has to see an eye doctor every year. And that's one question that we have to do. Are you seeing your eye doctor, you know? What did they tell you? Another one, okay, so this is the eye. It causes a damage to the blood vessels in your eyes, okay? Kidneys. That's why we're always doing a urine test. Make sure you're not spilling proteins through the urine. That's why we're checking your kidney function through your blood, okay? Why? Because if diabetes is not controlled, you're damaging your kidneys, okay? And then patients finish in dialysis and your kidney function starts to decrease, okay? That's one thing. Another thing, right, has to do with your nerves. Damage your nerves, so you have neuropathies. You're not feeling well as much as before, okay? I'm not feeling well, I have numbness, I have tingling. That's why it's very important that we always check our feet, okay? And then there's an increased risk factor to have strokes and also heart attacks. So diabetic patients need to be on a cholesterol medication. I know a lot of people don't like it, but it's as a preventive, okay? To help us have things well controlled. And just for you guys to know, right? It's also important, right, to know if you have symptoms of low blood sugar, okay? Because that's dangerous also, okay? And how would I know? I think you guys have no. Have you? Any of you guys had any of the symptoms of low blood sugar? Yes, Nick. What have you felt?
Shaky, sweaty, tired, dizzy.
Dizzy. Yeah. What do you do?
Eat a little bit of sugar.
Eat a little bit, exactly, because it's dangerous. One time I was in a place and I saw a man. He started slowly, and he fell, and everybody's like, wait, what is he? Is he diabetic? Yes. Bring something. Do you have a juice or something? His blood sugar was very low. We have to we need to make some action there. Okay. So these are simple things. Okay. I tried to explain what's diabetes. The classification, type 1, type 2, okay? The risk factors, things that we can change, okay? And complications if we don't take control of that diabetes, okay? We have a lot of more information around, right? So I'm going to pass it to, who's next, Nick?
Nick, yeah.
Okay. Any questions? You let me know, okay?
Thank
Hope
you,
you guys
Dr.
have learned, okay?
Good morning. How's everyone doing?
Good.
How about Dr. Cerna? She brought the energy, huh?
Yeah.
Yes.
You got a tough act to follow.
I know.
Yeah.
I'll try to see if I can reach the same bar.
You'll do better then.
This is, you're not taping it, right? You're taping right now? So one of those things we're going to raffle off. You'll get me one of those lanterns.
Yes, Bonnie, come on.
Give me one
Can everyone hear me okay?
Yes.
Yep. Okay, so Dr. Cerna's main goal was kind of like basics of diabetes, right? Risk factors, symptoms, and all that. So I'm going to dive a little bit more into how do we care for your diabetes, right? If you come into the clinic, what are the things that you talk about to help
Organic cream.
improve your diabetes care, your quality of life, and your health in general, okay? So first off, who am I? So I work at Shore with all these guys. I'm our clinical diabetes educator, and I'm also a holistic health coach. So I kind of come at it from both angles, where I do work around medications, and I work with our endocrinologists, but I also do a lot of work with lifestyle coaching. So looking at nutrition, looking at exercise, and all those other factors that Dr. Cerna mentioned. I've also lived with type 1 diabetes since I was 4 years old. So I've experienced kind of the ups and downs of diabetes myself. So when it comes to treating diabetes, what are our big goals of treatment? Dr. Cerna talked about some of these, but the big four that come to mind are managing blood sugar levels, avoiding and delaying complications, optimizing overall health, and improving quality of life. And I think a lot of times we tend to get very hyper-focused on blood sugar levels, which is a very important factor, but sometimes we look just at the numbers and we forget about these bottom two, optimizing overall health and improving quality of life, because that's really our goal for all of our patients is how do we have you guys have the best quality of life, focus more on living and less on worrying too much about your conditions like diabetes and other things. So diving right into some of the most important factors in controlling diabetes, nutrition and lifestyle. So something that I tell all my patients is that regardless of any diagnosis, whether it's diabetes or heart disease or cancer or anything you can be diagnosed with, you are a human being first. You're a human being above all of it, right? And again, a lot of times in the medical world, we tend to get very focused on a certain diagnosis, right? Like some might call me diabetic because I've had type 1 diabetes since I was very young. But underneath all that, like I am a person who's living with diabetes, and us as human beings, we have to do certain things in order to be healthy. And so I call those the foundations of health, right? So there are more factors than this, but on a basic level, mindset, the way we think about our health, the way we think about our bodies and our conditions, nutrition, the food that we eat, movement, the way we move our body, the kind of exercise that we do, sleep, the quality and quantity of sleep that we get, hydration, the amount of water that we drink, the quality of water that we drink, and stress management. So all of these things, again, sometimes we tend to forget about these things, and we talk a lot about medications, right? But I like to use the example of if you were building a house, right? You would want to have a really solid, sturdy foundation to build on top of, right? You can't put a ceiling, or you can't put a roof on a house that has no foundation. And so the same thing goes for your health, right? So if you don't have a solid foundation of a good mindset around your health, if you're not eating quality food, if you're not moving your body, if you're not hydrating, if you're not sleeping well, and if you're not managing your stress, we can keep throwing, medications and other treatments at your health, but without that solid foundation, we might not get the results that we're looking for. So I say all that just to say that these foundations, these lifestyle practices are really, really important, especially with a condition like diabetes. So, your daily habits and choices are the most effective tools you have for managing and treating disease, whether that's diabetes or anything else. So I want to do a little interactive exercise here. I'm going to go back to this slide. So this is going to be one that's about mindset. So let's have everyone close their eyes. Just take a couple deep breaths. And I want you guys to visualize, pretend that you're in your kitchen. So you're walking through your kitchen, you're feeling the cold tiles under your feet. You're walking over to your cupboard and you get out a cutting board. Okay, you're going to put that cutting board on your counter and you're going to reach into your fruit bowl and you're going to grab a lemon. So feel what that lemon feels like in your hand. Pretend you're really there. You're going to put that lemon on the cutting board and you're going to cut that lemon into 4 slices. You're going to grab one of those 4 slices. You're going to bring it up to your lips, and you're going to take a big bite. You're going to bite all the flesh out of that lemon. You're going to chew it up. You're feeling all that lemon juice in your mouth. Now, can someone tell me what they're experiencing?
Taste, sour.
Mhm.
Taste.
You get a little sour taste in your mouth.
Mm-hmm.
Sometimes
I
you
mean,
taste
also
the sour. Yeah.
I'm tasting the rind on the lemon.
Mhm. So, why did we do this? How does this relate to diabetes? All we did was we changed your thoughts, right? You started thinking about eating a lemon. And some of you guys mentioned feeling that sour taste in your mouth. We're not eating lemons right now, but your thoughts changed the reaction that your body had, right? There are no lemons here, but you were tasting sour. Your body was preparing for that sour taste, right? So we did this to illustrate the fact that every thought that you think affects every cell in your body, right? So if you're constantly having these thoughts like, oh, I just got diagnosed with diabetes, like, you know, this is in my family line, there's nothing I can do about it. Or, oh man, my body's so broken. Or, oh, I'm so sick, right? If you are having these really negative thoughts, it's probably going to lead to pretty negative reactions in your body, right? So having a positive mindset around your disease, like Dr. Cerna talked about, how, you know, there are all these risk factors that we can control, things that we can change. That's going to really make the difference between good diabetes treatment or treatment of any other condition. Okay, so when it comes to diabetes, of course, the lifestyle foundations are really important, but there's also a place for medication and monitoring. So when I say monitoring, I mean monitoring your blood sugars. So the reasons that we monitor blood sugars are because, of course, we want to maintain a healthy blood sugar range. We want to optimize our health and avoid some of those complications that Dr. Cerna talked about. We want to avoid hypoglycemia, which is those low blood sugar episodes, which can be life-threatening, and we want to minimize hyperglycemia. I always explain it to my patients like low blood sugar and high blood sugar, they're pretty similar. In both ways, we don't have our cells aren't getting that energy that Dr. Cerna explained. But with low blood sugar, it can be a very life-threatening acute issue, right? Whereas high blood sugar, we can live for a pretty long time with high blood sugars, but it's slowly breaking our bodies down. So we really don't want to spend too much time in either of those categories. We want to try to keep things at a good middle ground when it comes to blood sugar. So that's why monitoring is very important. So these days, there are 2 main ways that we monitor blood sugar. So the kind of classic way that we all know is what's called a glucometer. So this is where you prick your finger. Some of you guys might have one of these at home. And this tells us what your blood sugar is in the moment, right? So if I test my blood sugar before breakfast and it's 104, I have that data point, right? And then if I test it before lunch, say it's a little higher, say it's 180, I have two data points. Those are my blood sugars for the day, right? But blood sugar is always changing. So these days, we have what's called a continuous glucose monitor, and that is a little patch that you would wear on the back of your arm, and then that gets transmitted, your blood sugars get transmitted to a little receiver or to a cell phone. So that's testing your blood sugar every few minutes, and it's kind of plotting a graph of what your blood sugars are. So we can see in real time exactly what your blood sugars are doing rather than just at specific points in the day. We're seeing it throughout the whole day. So what that looks like is this. So this gentleman here, he's wearing a glucose monitor on the back of his arm, and he has his phone there, and that's showing a little graph of what his blood sugars are doing. And why that's really helpful to us is, well, one, for the patients, they can see their blood sugars in real time, so that can help them decide what they want to do with nutrition, with exercise, with their medications. But then from our standpoint in the clinic, we get to see these really cool graphs where it kind of breaks down all the different trends in their blood sugar, right? So this gentleman, he seems to be in a really good blood sugar range for the morning time, through the night and into the morning, but then as soon as lunchtime hits, his blood sugar shoots up really high, right? So we get to see these things, and we can help this gentleman troubleshoot. We can talk about what he's eating when his blood sugar goes up, We can talk about maybe increasing exercise that time of day. We might be able to move around some of his medications to help keep his blood sugars in a better range for more time. So then with medications, right, like I mentioned before, lifestyle is really important, but sometimes we need that extra help from some medications, right? And those medications are essentially helping those bodily processes that the lifestyle changes themselves can't do alone, can't fully address. So we're also looking to optimize blood sugar control, of course, trying to minimize those highs and lows, and we're trying to prevent those complications. So some medications that you might have seen. So we have oral medications. Those are like the pills that you might take, right? Things like metformin, Jardiance, Farxiga. You're going to see commercials for some of these too. We have injectable medications. Those would be like Ozempic or Mounjaro. And then we have insulin, right? So kind of like Dr. Cerna explained, our body makes insulin, but with diabetes, sometimes it struggles to make that insulin, or it doesn't make any insulin at all. So sometimes we have to supplement with taking insulin, either through injections like this pen here, or through an insulin pump. And so just to highlight some of that technology, these are two examples of insulin pumps. I'm actually wearing the same one that this gal is here. These both work in the same way, but the insulin in this one is in this little pod here. The insulin in this one is in the pump itself. This one has a tube, this one doesn't. They both do the same thing. They're essentially kind of like dripping insulin under the skin throughout the whole day rather than having to take multiple injections daily. So just an example so you guys get an idea of, the technology is really incredible these days. I wear both the glucose monitor that you saw that gentleman wearing in the picture before and the insulin pump, and they both communicate with each other and automatically make adjustments to help me manage my blood sugar. So in the clinic, we use a lot of this great technology to help improve our patients' quality of life and help them really focus on living their lives more than worrying too much about their condition. Right? The technology kind of helps take their hands off a little bit. Okay, so big takeaways, and you've heard these things time and time again already, but our big goal is looking to optimize glycemic control, optimize blood sugar, because our blood sugars tell us a lot about their health, and they can really determine our health going forward into the future. It's a multifactorial thing, meaning we use lifestyle, we use monitoring, and we use medications. So we really like to take a whole person, holistic approach. So like I said before, you really have to address those daily habits and choices in your lifestyle, as well as monitoring blood sugars and using medications if you need. And then one thing to keep in mind too is that treatment is always individualized. So everyone is very different, their needs are different, we're all different ages, different activity levels. So that's why coming into the clinic to see a trusted provider can be really helpful because they can help tailor treatment to you and what you need. Any questions?
Very
Yeah, go ahead. Yeah. So type 1 is where it's an autoimmune condition where the body sort of attacks the cells of the pancreas itself, and those cells are the ones that make insulin in your body. So your body does not make any insulin. So since I was 4 years old, my body hasn't made insulin, so I've had to use something like an insulin pump to help control that.
So, because I take one,
Mm-hmm.
I know people that take this.
Yeah,
Little
and
charger.
they're very
Little
similar
charger.
because the processes that go on are
Little
kind of the
charger
same.
can fall
With
off.
type 2 diabetes, sometimes the progression is a little
Charger.
slow. So eventually, there are plenty of people that have type 2 diabetes that do eventually need to take insulin. But sometimes it can be treated with
And it's a
simpler
solar.
medications like metformin and lifestyle changes. And those are always kind of, with type 2, those are always the first line, right? We want to try to do things as minimally as possible, try to focus on those lifestyle changes, maybe use some of the oral medications first, and then progress to insulin if need be. Which is great, yeah. Like Dr. Cerna said, that goal is kind of at 7, so if you can get below 6, that's fantastic. So you're doing a good job. I mean, I don't really like to use terms like which one is worse per se, because they both can kind of lead to similar symptoms. Type 1, you do need to be on insulin injections. Like there's no, like for survival, you have to be on insulin injections. So some might say that's the one that's a little bit worse. But again, I don't really like to use terms like that because depending on, there are plenty of people who live with type 1, like myself, who live very active, healthy lives, and it's just become part of my life rather than, something that is really taking over my life, so to speak. Correct, yeah. So those foundational pieces, right, are very, very important.
Something that I can add. For example, I have patients that are type 1 and they're 80 years old and they're so active. They're great. I have patients type 2 and they're 40 and they're already on dialysis, you see? So it's not, it all depends on the risk, like if you're taking a good control. Are you seeing your doctor, Are you taking care of what you're eating? Are you being physically active? Are you taking your medications? So it's as a whole, okay? So I agree totally with what Nick said. Don't use terms, but it all depends on.
Yep. Yeah. Anything else?
Well, thank you, Nick. Thanks for sharing your personal story, too. I think that makes a big difference.
Of course, yeah. So I'll be passing it along to Tiffany to talk more specifically about the nutrition side of things.
Yeah, well, while we're setting up, so my name is Brian King. I'm the marketing person for short. And I work with Yvette Soto. I don't know if anybody knows Yvette, but she's doing a great job for us. So, we have a sign-in sheet, so if you want to give us your name, your email, we'll keep you up to date on what's going on with our as well as at the hospital. We're having a drawing. Look at this cool thing, Yvette. It's right here. So it's a solar lantern with a little flashlight on it. So we have 4 of these that will raffle off. So if you give us your email address, you'll be into a drawing, and I'll work with Nelson to get it to you. And the other thing is Abraham is donating. You want to explain what this is? Some sort of topical cream, right?
It's his creation. It's an organic collagen cream that he came up with, and I use it. My face is always very soft.
If you use this cream, you'll be as beautiful as Yvette is. So we'll raffle that off also.
That has vitamin C, vitamin D, vitamin A, coconut oil, intermittent oil, base oil, and it's natural.
All natural.
Yes.
You can use that every day. You put it in your face.
All right, there you go. So thanks for filling that out, and we'll do after we do the next session. We'll randomize the award to the winner. So thank you very much. Thank you. Thank you for your time. And then also, Carol has those at the insulated lunch bags if everybody wants one.
Yes. Yes.
Hi everyone.
Hablando del
I'll let you finishing out your raffles. Where do they put the raffles?
I was going to make myself big. I'll put a raffle. You bet she doesn't speak English, but if you want to help her.
Yeah, I can help her. Yeah, ahorita le puedo ayudar después, Dulce. Yo le lleno la información. Yeah. Yeah. Déjame. Yo te lo lleno. No, ellos van a hacerlo en español ahorita, todo el mundo. La primera parte era en inglés.
pens to give?
Okay. Exciting raffles. My name is Tiffany Ríos. I'm very excited to be here. I've been a dietitian for 16 years, and I put together some slides, just the foundations, the basics of nutrition. Of these 16 years, these are things that I say in almost every visit. They can apply if you have diabetes and if you don't have diabetes. But it's really the foundation of understanding what's in your food and how to put food on a plate so that it's balanced and it's helpful for your body, okay? And you can feel free to ask me questions throughout as well. Okay, so there's this fancy word, macronutrients. It just means the basic nutrients that your body needs. They're broken down into 3: carbohydrates, proteins, and fats. Has anyone heard of these macronutrients before? Yeah, we just talked about carbohydrates, and Abraham was the breakdown of carbohydrates, which is glucose, right? So these all have different functions in the body, and they're all necessary, all very important. As Dr. Cerna said, we need to eat carbohydrates. They're the fuel for our brain, for our body, for every cell and tissue. Okay. So, starting off with, what are carbohydrates? Carbohydrates are the body's main source of energy. Okay, so the 2 things I want you to know about carbohydrates is that it is the source of fuel. Just like you use gasoline for your car, pretend there's no electric cars, okay? Just like you use gasoline for your car, your brain utilizes glucose for energy. That's how you function. Without it, you cannot function. But it happens to also be the one major nutrient that impacts your sugar level. So it is going to have the biggest punch on increasing your blood sugar level. Proteins have a lot of different functions, but let's simple it down to just 2 things that we want to talk about. 1, essential for growth and repair of your muscle tissue and tissue, which is very important for your metabolism. Everyone wants to have a fast metabolism, and you can't do that without having enough protein. And the other thing is that protein actually helps you to stabilize your blood sugar. So as carbs are increasing your blood sugar, if you eat those carbs with protein, you're actually able to slow down how quickly they rise. When you saw Nick show that graph of the blood sugar going straight up, a lot of times that's because there were a lot of carbs in the meal and not enough protein to balance it. So we'll talk about how to balance your plate with protein. And then fats. Fats are important for energy as well, but one of the things that they do is they help us to absorb vitamins and minerals, especially fat-soluble vitamins. These are things that we cannot absorb without eating fat. So if you're not eating enough fat, you're not going to get enough absorption of vitamin A, vitamin D, vitamin E. These are all really important for your function and the function of your cells. And on that note, vitamins and minerals. I don't have to tell you to eat your veggies, but eat your veggies. These are the foods that they boost your metabolism. They prevent you from getting sick. They really have so many different functions in the cell that are important for your overall well-being and just help you function smoother, okay, and better. Questions so far? So we got carbs, proteins, and fats. Okay, you guys are going to be masters at nutrition by the end of this. So some examples of foods that have carbs, okay? Who loves carbs?
Oh, everybody.
Yeah. I think people think that my office is a confessional for, like, everyone comes in there like, I love carbs, please don't take my carbs. I'm not taking anyone's carbs. I love carbs too. The key is how to balance those carbs with other foods, okay? But carbs are in, let's get real, they're in all the things we like, okay? If you're Hispanic, fruit has carbs, yep. If you're Hispanic, rice is a way of life, okay? I can't take away your rice. We got beans, we have bread, pasta, we have fruit. And it's funny, that's one of the things people say to me. They say, but I'm Italian, but I'm Cuban, but I'm from China. I have to eat rice, right? So I always say to them, you can eat all the foods you like. You can. It's just a matter of how you eat those foods. Are you eating them by themselves? Are you eating them in the right portion sizes? Are you balancing them with other things? That's really the key. And then protein, you have to do the muscle shot, because that helps you build muscle. Has a lot of other functions. One of my favorite things about protein is that it actually helps you to eat less, because it sends signals to your brain that lower hunger, okay? So when you eat more protein, you actually feel less hungry. And most of the time when people come to a dietitian, they're expecting a long list of things they can't eat. That's not me, because I wouldn't come back if that was me going to a dietitian. I'm going to tell you all the things you can't eat, okay? So eat more chicken, eat more fish, eat more nuts and seeds, eggs, cottage cheese, all the different kinds of things. We can find something for you, okay? There's always a way to eat healthy within the means of what you're currently eating. And then fats. A lot of us still think, we used to believe that fat made you fat. And that could not be further from the truth. We need fat for energy, to feel full. It's the same thing with the carbs. How much are you eating? What kinds are you eating? Are you balancing it with other things, right? So I know you probably see that there's no bacon or sausage on here. It's not that you can never eat bacon or sausage. It's just most of the time you want to try to eat these types. Avocados. Anyone here like avocado? Yes. Yeah. If you're from Puerto Rico, you love avocados. Avocado, olive oil, peanut butter. I love peanut butter, almond butter, any kind of butter, nut butter, whether it's almond or pecan or peanut. I actually don't know what this is. So I don't want to take a guess. Do you think it's butter? It's butter. Okay. I thought that might be it. But the main takeaway here would be this is regular butter, not the one in the container. Yeah. Okay? Those are it's a marketing scheme. Don't do it. Just get the regular butter. Okay? Yeah. Fish, nuts, and seeds, they give us just a couple cashews to represent. Coconut, and I think this is avocado oil potentially. So these are all what we call unsaturated fats, which is just it's fancy wording for eat more of these. Okay? Yeah, you can use coconut oil. Don't use more than I wouldn't deep frying it or anything, but in baking goods, it's a good oil to use. And 1 or 2 tablespoons is enough. Kerrygold or Vital Farms, those are both good options if they have those available. And if they don't have those at your grocery store, you can also just use regular butter. Yep. Okay, so this is putting it all together. All right, so this I have to tell you, is the most important thing I learned, okay, through all 5 years of schooling and through these 16 years. This is something that you can take with you everywhere you go, okay? And like Dr. Cerna said and Nick said, it's all about mindset, right? And focusing on what we can control. And this is something, every time you sit down at a meal, you can control what you put on your plate. So try to have half of your plate with vegetables, protein, and here is where you're gonna put your grains. So what are some of the carbohydrates that you like to eat? We'll start with you. Sorry, what's your name?
Tom.
Tom. What's your favorite carb that you would put in this section?
Rice.
Rice. Okay, so we got some rice. Okay, and what was your name? Claudette. Claudette. What are you going to put in the protein section? Oh, that goes in this section. That goes in the grain section. So we got rice there. We got rice there already. Yes, I asked you about the greens. I want to know from you what protein.
Chicken or fish.
Chicken or fish? Okay. So we'll put some chicken here with rice. And then, what was your name?
Él no escucha bien ella. She doesn't hear good.
Okay. ¿Qué es su nombre? Ada. Ada, okay. ¿Qué tipo de vegetal quiere poner ahí?
She's from Alabama.
Oh, I'm so sorry.
No, ella habla
Okay,
con lunch.
fish.
What is the left
Yes.
side? That's bread?
This one's bread. Yep, we have rice there. We have chicken here. This one's vegetable.
Okay.
Like broccoli. Do you like broccoli? Okay, there we go. So we've got broccoli, chicken, and rice. See how simple that is? That's how we do this. We just put these together. Then we talk about portion sizes too. But this is what really changed my life, because I used to eat, as a Cuban American, okay, rice, beans, something fried. Okay?
Yeah.
All right, that was what I grew up on. So
It's
introducing
true.
this really changed my life. Okay, and I put a picture of a traditional meal for Latinos. We do have the chicken and the rice, maybe some beans, some avocado, lots of vegetables. So the American Diabetes Association has this plate that you can find wherever you're from. They have a plate that has those cultural relevant foods that you can make your own plate, just like the one we showed you, that's balanced. And this is just some tips on how to use your hand for portions, okay? So the palm of your hand, that's for the protein, okay? And the thumb, that's for dairy, also fat. Two fists together, that's for the vegetables, okay? One fist, that's for your potatoes or your rice. So you can take your fist out, look at it. That's about how much rice or pasta that you would want to serve yourself at a meal. A small cupped hand, that's nuts. Nuts are very healthy, but if you put 2 cups, that might be a lot of calories for your body. And then a fingertip is about a teaspoon of butter, okay? See, that's the regular butter. Container. So this is a helpful tool you can use, just your hand, for portion sizes. Are you laughing at the size of the rice?
Yeah, I'm thinking about for the rice.
Yeah.
What they call?
You're doing this one, huh?
No, that's the thing.
Yes.
For the rice, I'm thinking, oh my God, I love rice. Like,
Yes.
You know,
Yeah.
in a big bowl. Like,
I know. I've had people show me the amount of rice that they eat by just showing them a bowl. And I'm like, I know.
Gets us in
Good
trouble.
stuff. So, but yeah, the key thing too is when you balance it, what I found is when you put the rice as not the whole meal, it's part of, remember, it's part of another meal. You'd be surprised how full you get. You get full faster.
Yes.
Because you have a variety of nutrients. So our brains like to focus on eating the same way, but just give it a try. Just one meal, give it a try and see.
I have a question. If you have
Yeah.
beans, would that be a veggie or would that be a grain?
That's a great. He's asking if beans are a vegetable or a grain. The great question. So beans are a legume, which makes them a carb, which makes them go into this category.
Okay.
Yeah. So that's the thing too with Hispanics. We not only like to have our maybe 3 cups of rice, but then we're adding beans to it. We might add plantains, right? And depending on where you're from, we tend to overconsume this. So there's a lot of Abrahams out there. I'm sorry? Yeah, so this would be roughly, probably around 2 carbs. We have to measure it. Usually it's about a half a cup is a serving.
I have a question.
Yeah.
Lentils and split peas, are they considered carbs as well, or?
Yes, so the thing about legumes is that it's a little tricky, okay? They're both. So, let's see here.
Because they have a lot of protein as
So
well.
they have both, yeah. They have a little bit of protein and grain. But what that makes them is a good carb.
That's a good carb.
Okay, so that means that they help you stay full, and they're a good choice because they're balancing out your blood sugar just on their own. Okay, and this is sort of, if I had to say what the top 3 things are that happen and that deter people from having good health or balanced nutrition, rather, it's eating a lot of foods that come in bags.
right? So a lot of and you don't need me to tell you that. You know when you open the bag, this isn't good for you. You know that. But I'm just here to remind you.
Yeah,
I'm
that's
just
true.
here to remind you that, you know, these sweet and salty snacks, they're not going to make you feel full, so you can eat a lot of them.
Yeah.
That's the problem, is that, you know, while they taste delicious, they're easy to overeat and they increase your blood sugar a lot. Skipping meals, this is so common. We think by not eating, it's going to help us lose weight, we're going to balance our blood sugar, but the opposite is true, because a lot of times we end up eating double by the time we sit down to eat, and we're eating late at night when our metabolism is slower. Okay? And not drinking enough water. I am guilty of this. I gotta work on this one too. I'm confessing, okay? Essential for your digestion and your overall health. And a lot of times we think we're hungry and we're dehydrated. So staying hydrated can actually help you be more in touch with your appetite. Okay? Lots of benefits, good for kidney health as well. And like Dr. Cerna said, if your blood sugar's high, it helps dilute some of that sugar concentrated in your bloodstream. So creating a healthy meal plan, try to eat mostly whole foods, okay? So less from the packages, more things like chicken, fish, vegetables, a good portion of beans, rice, potato, whatever type of carb you like. Use your hands to balance out your portions, and try to eat a meal about every 4 to 5 hours. That's ideal. Once you go over that time frame, it's easier for us to pick up snacks and overeat. And that's all for me. Thank you. Thank you guys. Thank you so much for listening. Any questions? Any other questions? Any other questions? No.
You are reiterating, because most of us know.
Yeah.
But sometimes we're thin.
Yes.
And as I get older, the more I hear it, the more
Mucho esperando.
Yeah. Absolutely.
Le pueden hacer pueden chequear la presión. Yo no sé.
Yeah.
There's a whole bunch of people waiting outside.
I was thinking of the second group.
They can come in.
Yeah, they could eat.
I
They
think
can
hearing
eat.
things
Yeah.
from another perspective is always helpful. So I'm glad you said that. Yeah. I didn't. Sorry. I can give you my contact info so that if you do have questions, I can follow up with you. Okay. So wonderful. I think I'm passing it back to Dr. Cerna. Yeah, of course. Oh, you are? Oh, we got a cute sister here. I love it. Okay. Seeing you. Seeing you. I think this was great, right? Have we learned a lot? Yeah. All right. Thank you for coming. If anything, just let us know. You've been great.